Hey guys, Dr. Katie Conklin here again at Animalia. We have a good one for you today. We'll be talking about senior care. This was actually the #1 requested topic, so we're going to dive right in. First up, one of the things we want to consider when we're talking about our older animals is monitoring for chronic disease. And that can mean a myriad of things. That can be endocrine disorders like Cushing's disease, diabetes, or thyroid issues. That can be heart disease. That can also include organ system issues like chronic kidney disease and things like that. We also want to monitor for the scary thing that we don't want to think about, but cancers as well that can show up late in age. One of the best ways we can do that is making sure we're sticking to our at least yearly exams so we can get our hands on your animal and just really do a good physical exam on them. Some monitoring you can do at home, though. Some common signs that we can hear, really not specific to any one of these disorders, but that we may hear that may clue us in. That you can monitor at home is going to be extra drinking of water, like a lot of extra water intake and a lot of extra urination. They may start having accidents inside when they've never done that before. Decreased appetite, that can be significant or mild. It really just depends. Watch for changes in weight. If all of a sudden it looks like your dog's lost a good amount of weight and you have not been trying, you haven't been cutting back on calories, then that's something we need to know. Behavior changes. Are they hiding? Are they not engaging? Are they all of a sudden a little bit mean or fractious in certain circumstances where they never were? That can be a sign. And also decreased exercise, and that's particularly important with heart disease. Like all of a sudden, Fluffy was able to walk a full mile, no problem, and now he can only make it, a couple blocks without getting winded. So we need to know about that. So definitely come on in. What we would probably do is we start out with senior lab work, which is a little bit of a standard panel that you normally have from your younger animals. It just has extra information like urinalysis, maybe some thyroid screen, and then we can also do imaging. We do an imaging package here for our seniors where we take a really good look in the chest and the abdomen with radiographs and also ultrasound to take a good look and make sure we're not catching any masses or anything like that at a very small size, which is the best time to catch them. So next up, dental disease. So dental disease is by no means singular to the senior population. Always start your dogs off early. Start with over-the-counter products for at-home care and dental cleanings as soon as your veterinarian says it's time, because the most we can do on the front end, it kind of delays, all the oral surgery and problems later down the road. So if we are focusing on our senior animals that may be having extreme dental disease, some things you may notice is all of a sudden maybe dropping food, dropping some kibbles here and there. I always like to ask if our dogs and cats are crunching on their kibble. Are they swallowing it, bypassing the teeth completely? Or are they still crunching on it? And sometimes you can just see them be a little bit subdued. They're usually really happy when they have maybe a mouthful of teeth that were infected and abscessed and painful, and we get them out. They tend to act like puppies again after that. So if you notice any of those changes, for some really good guidance on at-home products you can use even with your senior pets, there is a group called the Veterinary Oral Health Council that you can find online. They're a group of veterinary dentists that have put together a lot of information, but one of the things is a list of products that they endorse. So if you're going to spend your money on something, check that list and grab something from that list. And don't forget, nothing is going to replace a full anesthetized dental exam plus minus tooth extraction if needed. So definitely seek, the guidance of your veterinarian if that is recommended. Last but not least, we're going to talk about pain a little bit. Dr. Lizzie Moser did an awesome video on that recently, so I'll touch on a little bit just kind of what to look for and what it actually is in older pets. The #1 thing we're worried about, obviously, is osteoarthritis or degenerative joint disease. And that's where basically the joint just becomes abnormal. So there's some cartilage wear, and it draws in inflammation and pain, essentially. So some things you may notice is some creaking in the joints. Maybe they're slow to rise. Maybe they don't want to exercise as much. Maybe they are kind of stilted and moving around. Those can all be signs of osteoarthritis. If you notice that, we'll do a thorough musculoskeletal exam on them, take them through passive range of motion, feel for that crepitus, which is the creaky noise in all the joints. And likely the best thing we can do to diagnose it is a sedated radiograph. We do sedated because we do have to pull on them quite a bit to get really good images of their joints, and that's probably painful for a dog that has osteoarthritis, so we prefer to be kind and definitely sedate them for those procedures. If you're interested on how to handle the pain, if we do diagnose osteoarthritis in your dogs, definitely refer back to Dr. Moser's video. She discussed all the modalities that we can use and seek the help of your veterinarian. Last two pearls of wisdom regarding osteoarthritis I'm going to give to you is the difference between dogs and cats. Cats can be sneaky about pain, so you have to be keyed into kind of their weird behaviors sometimes. Sometimes we'll see them stop using the litter box altogether. They'll maybe go to the bathroom right outside the litter box because it hurts to get in. If they're not climbing, if they're not jumping, that can be a sign of pain in cats. They won't usually limp. So if we're seeing a cat limping, we've missed it for quite some time. Secondarily is weight. You'll hear us here at Animalia talk to you about your animal's weight all the time. And the reason being is, especially with osteoarthritis conditions, every pound you can get off your animal, you're taking tons of pounds of pressure off of their joints, and you can make them so much more comfortable if you keep them at a lean body weight, sailing into their golden years. So that's it for me today. Always reach out to us if you have questions. We're happy to see our senior animals. We love all of our senior animals, and we'll see you next time. Thanks.